In 1853, women were warned not to bathe during their periods, not even with warm water. Doctors believed it could cause madness, infertility, or even death. This wasn't just superstition, it was official medical advice. Today we're diving deep into just one bizarre 19th century rule: don't bathe while menstruating. Dr. E.J. Tilt, a respected women's physician in 1853, warned women against warm baths during menstruation. He believed warm water would increase blood flow to the uterus, leading to something called pelvic congestion. Pelvic congestion was thought to be a dangerous pooling of blood in the womb or pelvis, caused by overstimulation, heat, or too much movement. Doctors blamed it for cramps, uterine irritation, and even mental breakdowns, despite not fully understanding circulation or the reproductive system. This congestion, they believed, could overstimulate the nervous womb, trigger fainting fits, or result in what they often called hysteria, a catch-all diagnosis for female emotional distress. So to play it safe, the advice was clear: no warm baths, no soaking, no stimulation. So what were women allowed to do instead? Cold sponge baths. Specifically, Dr. Tilt recommended sponge bathing the upper body with cold water and vinegar, but warned against cleaning the abdomen or lower body during menstruation. This vinegar water was believed to firm the tissues and tone the nerves. At the time, physicians used terms like uterine tone, the idea that the uterus was like a muscle that could be too loose, too tight, or easily thrown out of balance. They feared that warmth or water would relax the womb too much, weakening its natural structure. Cold was believed to strengthen the body, while warmth was considered dangerously softening. Tilt also warned that washing too aggressively could excite the nerves of the pelvic region. Exciting the nerves was a Victorian euphemism. It meant triggering sexual arousal or emotional agitation. Doctors believed a woman's emotions were physically tied to her womb. Any stimulation, even from bathing, could threaten both her morality and her mental stability. Tilt and other physicians strongly discouraged full immersion baths during menstruation. They believed soaking in warm water could loosen the uterine tone, cause pelvic congestion, and disturb the balance of the system. Balance the system was a popular medical theory rooted in ancient humoral beliefs that the body worked best when all forces, fluids, energies, nerves, were in perfect harmony. Menstruation was seen as a natural but dangerous release, and any disruption could unbalance the entire female body, leading to chronic weakness or madness. Some even feared that bathing could stop menstruation altogether, leading to so-called suppressed menses, which they thought poisoned the bloodstream. Fast forward to today. Warm showers relieve cramps by relaxing abdominal muscles. Bathing prevents infection and helps with odor, discomfort, and mood. Washing your hair doesn't cause illness, and the uterus is not involved. There's no such thing as loosening your uterine tone with water. In fact, many OB/GYNs recommend warm baths for period pain. Modern hygiene is about comfort, safety, and science, not fear or modesty. In 1853, women were told to sponge themselves with vinegar and avoid pleasure, heat, or relief. Today, we know better. So the next time you step into a hot shower during your period, be thankful you're not being told to cool the womb and balance your system. What do you think? Would you survive Victorian period hygiene? Subscribe for the next video. Corsets and crushed organs: Victorian fashion's war on women's bodies.